Okay, so we are back. This topic, this little mini topic, is going to be about normative theories of ethics, the ethics that we use to apply to our behaviors to make decisions. Um, so we'll start with deontology. It's from the Greek word deon, meaning obligation or duty. That an act was moral if its motives or intentions were good, regardless of the outcomes. So there's some problems with using this as a model for decision making. We know that in healthcare, outcomes matter. It's not enough to care in your heart if you don't have the skill or knowledge to do so safely. Outcomes do matter. So deontology has limited application in nursing. However, sometimes we don't always have good guidelines for practice. We can encounter a novel situation, and we have knowledge and skills that we can apply, but we don't know necessarily what the outcome's going to do. There's a risk. So the guideline for healthcare workers in that scenario is what would a reasonably prudent person do? Um, and then we do the best we can. We follow the best available evidence and we accept the outcome. Um, and we try and reevaluate and see if a better plan would work if we don't get the outcome we expect. So one example of deontology could be Good Samaritan laws. So you find a person who's unresponsive, they don't have a pulse, they're not breathing. Even if you do CPR wrong, doing it at all is the moral choice. Any attempt at saving a life is better than none. The person is dead otherwise, and it really doesn't get worse than that. So that would be one good application of deontology. Your book talks about act deontologists and rule deontologists. I'll discuss those really briefly. I'll just give you the definition. So, act deontologists determine the right thing to do by gathering all of the facts, the best available evidence, the best guidelines, the knowledge, the skill, and then you make a decision. You find out what's important to the patient, and you make the best decision you can, not necessarily knowing what the outcome will be. Rule deontologists emphasize that principles guide our actions, but nursing is much more of an act deontology framework when we have to use deontology at all. Immanuel Kant is pictured here. You do not need to know him for an exam or anything like that, but just so you know, he was sort of the father of deontology, modern deontology. And his philosophy was that people inherently know right from wrong. The problem is that they don't always do the right thing. So, moving on to the next normative theory of ethics, we have utilitarianism. And this means that an action is good if it gets the best outcome for the greatest number of people. That is also problematic in healthcare because you think about it, if you have that sort of, well, we're going to do what's best for the majority, you leave out a lot of vulnerable populations. Indigenous peoples are only 2% of the population in America, and yet we have to value them and respect them and give them the same equitable access to care. So utilitarianism sort of spreads out thin resources, but it can exclude people from care. So it's got some application, but not a whole lot. We have to look at every individual as having worth and value and really go out of our way to increase access to equitable healthcare for people who need it and who don't have it. One application of utilitarianism, and this you might see again, so just, put a little star next to your notes. This is a triage tag. So when you're in a mass casualty and there are a lot of people and you're going to try and save as many lives as you can with the limited resources you have, the healthcare worker, the triage nurse, will apply a tag. The black tag is for somebody who is dead or dying. You cannot give that person care because it is wasting a resource that could be used by someone else. A green tag is a minor injury. These are like cuts and bruises. The person is going to recover whether you take care of them or not. So the black tags and the green tags kind of get ignored. The red tag gets all the attention. That is somebody who has a life-threatening injury who can be saved with immediate attention. So it's a way to prioritize patient needs. And then delayed is this person does need medical care, but they can wait until we have addressed the needs of the people with those red tags. So this attempts to save as many lives as possible, realistically with the resources you have. Now, in an ideal world, we would never leave someone alone to die after a major disaster. It's kind of cruel. But if we want to save as many people as we can and prevent as much tragedy as we can, then, utilitarianism makes sense. Virtue ethics. This is more commonly used in nursing. So it emphasizes the character of the decision maker. Virtues become part of who you are. They are tendencies to act, feel, and judge that develop through training, but also from making good choices and from natural desire to be a good person. Individuals' actions are sort of built. Smaller actions lead to bigger actions, lead to inborn sort of character. Internalization of virtues might be what separates a competent nurse who gives safe and effective care from the exemplary nurse who injects and infuses care into her care. That she goes above and beyond to make sure that her patient is not just safe, doesn't just get the required care. She's not just checking off boxes. She's doing it in a way that reflects her values and virtues, or his. I'm so sorry for defaulting to her. I work on an almost exclusively female unit, and I still kind of deal with the prejudices we all have with that. Normative theories of ethics continued. We have principalism, and this is the use of overarching principles to make decisions. We also use this to guide policies, position statements, and they provide an internal framework for decisions that we make. Now, there are 6 that nursing uses. They are based on the original 4 that medicine espoused. They are, and you've heard these words before, I'm sure, autonomy, which is the patient's right to determine how healthcare happens to them, what the outcome is. They have autonomy over their bodies and their choices. Beneficence, which is the wish to improve someone's condition, to do good. Non-maleficence, which involves not doing harm, avoiding errors, being careful. Justice, which is, fairness. Fidelity, you keep your promises. You are faithful to the code of ethics. You keep your promise to your employer, to your patients, to your colleagues. And veracity or honesty, and that includes both what you say, what you document. And this provides guidance for most things. Most of us like to personify these characteristics, but sometimes 2 principles conflict with one another. For example, we believe in patient autonomy, but when a patient presents to a mental health facility and they say, I don't belong here, I'm going home, so I want to sign out AMA. Well, they're not really allowed to do that if they are a danger to themselves or others. In that event, we have 2 conflicting, or 3, really, non-maleficence, which means we don't want this person to harm themselves or anyone else. Beneficence, which means that we don't want them to suffer from this mental health condition. That's why they would be leaving against medical advice. And autonomy, which is the person's right to decide what's good for themselves. So we have a conflict in values there, in principles. So principles only kind of go so far when it comes to that. And sometimes we need ethical guidance from other agencies like the law. We're going to take a break here, and we'll come back and discuss ethics in nursing.